On Monday, January 25th, the Baker-Polito administration announced an expansion of COVID-19 vaccination sites across the state. The administration also updated Phase 2 of the distribution. Individuals who are 75 years or older will now be the first priority group in Phase 2. If the state receives enough supply from the federal government, they should be able to get a vaccination starting February 1st. Vaccination sites can be found at mass.gov/COVID vaccine map. We spoke with the director of Needham Health and Human Services, Timothy McDonald, to find out what residents should expect when receiving the vaccine.
The Pfizer and BioNTech vaccine requires a second shot 21 days after the first shot. The Moderna, which is the one that we've been giving so far in Needham, requires a second shot 28 days after the first shot. There is some wiggle room. It doesn't have to be exactly 28 days, but that's what we're sort of shooting for. We're really hoping that it will be 28 days because that's the period that was studied for maximum efficacy of the vaccines. It's important for people to know that when they do get the vaccine, there's generally a period, and it's about 21 days. So after their second vaccine, before they sort of have the full benefits of the vaccination, it takes a little while to sort of build up in your system and for your immune system to develop the resistance to the virus. And many people, when they have gotten the second dose, have felt some negative effects. So that's been a headache, some chills, some things like that. In many cases, not all, some people have had to take a day off from work or have to go home early because they had a bad headache. It's generally faded within a day or so. Most people have had few, if any, ill effects after the first dose. So that's important for residents to understand that there are some side effects of getting the vaccine. They have been studied pretty closely. They're all very minor. We do, after everyone gets a vaccine, we monitor them for a minimum of 15 minutes. Usually if people have participated in flu clinics in the past, we kind of give you your shot and you're in and out really quick. With the COVID vaccination, it's much slower. You have to come in, you pre-register, you come in, we check in, you get your vaccine and you sit for either 15 minutes, or if you've ever had a history of anaphylaxis for whatever reason, extreme shellfish allergy, response to peanuts, bee stings, something like that. If you've ever had a history of anaphylaxis, you have to be observed for a minimum of 30 minutes after getting the vaccination, just to make sure there are no ill effects. So that's something that we do. And then we let people know that they might have a headache, they might feel a little bit tired. So most people are, letting their employers know that I am getting the vaccine and I might be calling you tomorrow to say I'm really not feeling well and I'm not going to be able to come in.